If you've never been lonely, you don't realise what it is like.
It feels as though you've been dumped in the deep end and there's nobody there to rescue you.
Well, you go hours and hours, never speak to anybody.
I don't think you'll ever get used to it. You know, it's always loneliness.
How do you measure loneliness when even trying to talk about it takes your breath away?
The room's just empty.
"91-year-old Margaret Nicholas has lived in this house virtually her whole life. First with her parents, then her husband and family. 2 years ago her husband died. Now it's just her.
We used to do the garden together, do our shopping together. Everything was done together.
But you obviously miss him.
I do.
Margaret's granddaughter takes her shopping and neighbours pop in to check she's okay. But it's everyday company she misses.
Some people would think me a bit odd, but I do chatter to my husband. I do it so I'm sort of, speaking.
That's the wife with a cousin.
Roy Croucher lives a short drive away. He and Margaret have loneliness in common. He lost his only son to cancer and then his wife for 50 years.
I'm always hoping that the wife will come through the door, which she never will. If you go out, you come back, and you come back to an empty house, and it's loneliness again. And you're always waiting for somebody to call.
Roy says he's lucky. A friend and her family see him most weeks. But like Margaret, some days the only voice he'll hear is a call from a phone befriending service run by volunteers.
Julie rings up on a Saturday night, because last Saturday she was the first person I spoke to all day.
And that's a long day.
It is a long day.
And how much difference has that made, that phone call that comes on Saturday night when you haven't spoken to anyone else all day?
Well, I always look forward to it. I always put that phone on the seat, ready to pick it up. And that's a great help.
The campaign to end loneliness says it should now be treated as a public health issue. Identifying the most vulnerable is critical, then offering support to cope with the bewildering and painful reality of ending up alone.
I've never been on my own ever before. No.
And so getting used to that has been hard.
It has. I don't think I shall ever get really used to it.
It's just something that is thrown at you. And you can't throw it back to anybody. You've got to just carry on.
Thank you all for joining us again for round 2, night 2. We're going to be jumping back in just here with a recap of some of what we went over yesterday. And ultimately, we spoke a little bit about the human needs. We talked about the physical, the mental, the social, spiritual needs, which are really important to complete the whole person when we speak and meet with people. Also, when we're speaking to you, visiting, on visiting, we want to make sure that when you meet, you can go in couples, in pairs. That's the best way. Making sure you're prepared before you leave, knowing the protocols, whatever COVID protocols exist there, wherever you're visiting. Making sure you have your police, your vulnerable sector check completed. You have your protective equipment, whatever you may need. Any type of activity or a notebook or a journal for yourself would be really handy to have. And also just keeping in mind, obviously, how you want to be treated is the same way you want to treat others, certain courtesies. And if you happen to have your notebooks already. If you don't have them, you can get some still. We have many copies available at the office, and I can mail these to you as well. We've actually been getting a steady stream of orders coming in from our emails. So thank you for those that have requested these books. We're working on getting these out to you, so you should get them by tomorrow, or if not, by probably early next week. Okay, so definitely you can reach out to us for that, and we'll send those over to you. And you can also go into the chat box and click on the link here for the training program to view the slides, the information, the content that we'll be sharing with you if you'd like to see that on your side as well. But you don't need that for tonight, so you can just follow along with our presentation. So thank you all for joining us again. We're going to segue into the next half of the session, which will be focusing now on chapter 4 in your book, which is communicating with persons with disabilities. And so what's really key here and important, I find, is that the ability to communicate effectively is very important, and it should be taken very seriously. Obviously, if someone happens to be a person with a disability, we want to encourage them to share with them, what their story is, and ensure that they have a smooth process. Some communication tips for that just that transmission of information especially is not to assume that the person needs help. They may not want it necessarily. They may want to simply be doing everything on their own. I mentioned this, I have 4 little ones, and I have a 2-year-old who's the second youngest, and seeing that he's sandwiched between the 2 older kids and the newest one, he's very independent. So he always wants to do everything himself, from putting on his, trousers to, flushing the toilet, everything. Even if, he's going to make a mess out of it, he wants to do it. So I've taken the lead away from myself, and I've just let him do it. And I find it's really important to not assume and not make decisions with others when we're meeting with people. Even my own parents, I find the same thing applies. If they're hungry or they haven't eaten all day, maybe they don't want to eat. They just don't want to nourish themselves towards the second half of the day or have a drink of water. Maybe they just prefer nothing. And so just assuming certain things, it may not be helpful. So just don't make any decisions. Don't offer food if they don't want food, obviously. If they do, great. If not, that's fine. When you're speaking to someone, we want to speak directly to the person. So we're focused on that individual and not really easily distracted with any other things that are happening around us. Often you may have people walking into a setting, if it's a nursing home, residential residence where there's shared accommodations, you may want to resist the, involving other people in the vicinity to your conversation with that individual. Some people like that, other people prefer just to be there with you present one-on-one. So definitely speaking direct to the person that you're meeting with is key here. Definitely, and also in being sensitive to the person that you're speaking to. Use words that are powerful, meaning words that will actually give the person hope. Avoid any disempowering words. If you're speaking, for example, to a person who has a disability, you don't ever want to use words like a victim or suffer. Avoid those negative connotations, because those are really going to bring someone, potentially down in terms of their mental, their well-being, even especially. And that goes along with the assumptions. So we don't want to assume anything about someone and how they feel about their own situation or their own, their own well-being. When it comes to sensitivities, we want to make sure that we're sensitive to them when it comes to touch. Oftentimes people may want, no touch whatsoever. Some people prefer having a handheld, for example. That's something just to be aware of. Definitely a quiet environment. It makes for easier communication. So if you need to remove yourself from where you're located with an individual and you want to relocate to an area that's a little bit more quiet, maybe not as bright, that's another consideration. That might be a good idea. And also when you're visiting, you want to ensure that, you're going to be speaking to the people that you're meeting with and interacting with so many people. Yesterday, there was a really good tip. One of the ladies brought up this is before you meet and go into a nursing home, ensure you can talk to someone about the visit. If it happens to be a residence or nursing home, long-term care facility, talk to that nurse coordinator or that recreational coordinator to get some insights into that person who you're going to be meeting with potentially, so that you have an awareness of that person's, interests, maybe what you want to do with that person, or what's available to you even in that center. So that's a great tip. So thank you to whoever shared that. And then the next point we want to mention here with communication is when you happen to be communicating with someone who may be on the spectrum with autism, avoid using certain language that may be confusing. So for example, we know people with who may be on the spectrum, they want to understand and have the same cognition ability that you present when you're speaking to them. So avoid, certain kind of, what do they call it? Sarcasm or figures of speech. If you don't know that the person is completely aware of what you're referring to, maybe avoid that. There's certain types of language that you wouldn't say outside, and maybe you should just avoid certain speech and certain discussions if you feel that that might confuse or disorientate someone. Especially when you're talking, you want to ensure that you're using short, simple sentences. Be aware of their body language. If someone feels like very constrained and kind of shut in, you definitely want to help them relax and be more vocal and open with what they're sharing. One thing I've noticed in my own children, I have a newborn, 5 months, when he's hungry, his hands and his fists are like this, and he just holds them like this. But once he starts to actually release those hands, you can see him opening up, usually after he's been fed or he's just at ease with someone. You can see his body relaxes completely. That's the same kind of idea. Some people might be really tense in their life, and then when you come into that space, you open them up to receiving and being with them. That way you actually have an opportunity to encourage them to open as well. Okay. When you're asking questions, it's really nice to use closed-ended questions. So simply saying, would you like to go to the park? Would you like to go for a walk? Or would you prefer to stay here? So you want to ask a closed-ended question, have them respond to that question, and then move on to the next question. And of course, definitely making sure you're not hurried. So if you have someone perhaps with a chronic medical condition, you may not even know that they have a medical condition, and you won't need to communicate any differently. So don't assume something's going on. For anyone who, can everyone hear me, by the way, if just to make sure that everyone can hear? Okay, great, thanks. So I would say for someone who may have, especially with the elderly, they might incur some type of condition as they age later in life. For example, a stroke make someone very sensitive to certain things, certain sounds, or, they have a condition now that's created in their body. For example, with their speech, they might have an impediment with the speech that they can't voice themselves as they would have otherwise. So we just want to be sensitive to that, be aware of their body language. Sometimes if people are fidgety or restless, you may assume they're bored, but they're not actually bored. They might actually have a condition. They might have a UTI. They might need to use a washroom, or they might just simply have something going on as well that it might be a layering effect of something else that's under the surface. If you are in a situation where there's a little bit of a situation arising, or the person is becoming upset, please ask for help. Definitely remain calm and keep your voice unhurried, so that you can do anything if you can avoid any kind of harm to the person, but making sure that you're taking care of them and you can help them as well. Okay, that's really important. And also we want to make sure that when you're speaking to people and using that certain language, we use words that are flexible. So we may, instead of not saying things like, we're not going to go here. So flexible words, sorry, going back to this one slide here, we're going to say things like may instead of not necessarily doing something, just because you want to be open and flexible in your language as well. Okay, so for the next slide, when you're speaking to assisting someone, if someone has a chronic condition, again, you want to make sure that any needs are addressed. So the physical sense is really important. And if someone has an episode, or for example, if they're schizophrenic, you want to ensure that you acknowledge what's happening to them. It's not your reality, but it could be their reality in that moment. So you just want to understand where they're coming from, and accept that, and go for that help or support if you need it. And definitely tell the person what you're doing before you are responding to them directly, because you definitely want them to know what you're doing and what they're going to be expecting from you. Okay. So, and the next thing, if you happen to be in, you know, visiting with someone who has a hearing difficulty, they may have trouble actually understanding what you're saying. And so when you are speaking, you want to, if you have a trouble or issue hearing someone speak, you want to let them know. The person may actually be difficult for them to hear, so they might be hard of hearing. Definitely feel free to rephrase certain things that you're saying. If you notice in their body language that they're not responding to what you're saying, you may want to rephrase what you're saying. Okay. When you're speaking to someone in their face, you may not notice certain cues, like they're just looking at you puzzled. You may want to pick up on that. So it's important to rephrase your sentences if you feel like they can't understand you. And if you are having an interpreter present when you're visiting with someone, maintain eye contact with the person you're meeting with, not with just the interpreter, okay, or a translator. You definitely want to maintain contact with the person that you're supposed to be sitting or meeting with. And then face the person when you're talking. Don't sit in front of a light. I have a window right here, but if I sat in front of that window, you'd be looking into a steady stream of light right in front of you in your eyes. So that's really uncomfortable. So we want to avoid that. And that just makes, excuse me, common sense. So just being considerate of where that person is sitting, what their view is going to impact and in what kind of effect it'll have on them. And definitely speaking clearly. So if you prefer, you want to move, you know, just ask them, may I move over here if that's okay with you? Would you be more comfortable if we sat over here on the couch versus on the chairs over there? Just making sense of where you're at and what's happening around you. Another point in consideration is with people with hearing difficulties, you definitely don't want to yell. Okay, my husband likes to speak really low on an even tone. So every word sounds like the next word. And I have to find myself really steering clear to understand what he's saying. But that's fine. And so my dad, on the flip side, is very loud, very robust, and just likes to be bold when he speaks. So it's very easy to hear them. When the two encounter one another, it's like misplaced pieces. You know, one person is too loud and the other one's too quiet. So it's fun. What I'm saying is, when you are speaking with someone, avoid chewing gum, for example, because sometimes people will find that they're watching your mouth, they're reading lips, and that might confuse them as well. If you're having a mask, that may also make it really obscured for them to hear what you're saying. So maybe trying to lift your mask or show your face when you're speaking. That's another good point to keep in mind as well. And for the next point, when we're talking about disabilities, for example, with someone with a learning disability, we do want to encourage older people. If you are meeting with someone who has an acquired learning disability, perhaps someone who experienced an event in their life that made them develop a learning disability afterwards, definitely keep that in mind. That could occur, and it is quite common. You definitely want to use short, clear, direct sentences, not be labored on what you're trying to transfer in terms of information to them. You want to maybe rephrase certain things. If you find that they're not accepting what you're saying or they don't understand what you're saying, you may want to simply just, you know, reiterate what you mean in different terms. So simplify it and make use of what you think they might actually understand. Definitely another good option is to draw or point to things. If you find that there's a visual difference or maybe a disability, maybe you want to highlight or in bold something that you're showing them. Oftentimes I'll take a piece of paper and I'll just write and scribble into my book, and I'll write down what I think they need to see so they can understand what I mean. And visual aids, that's an example right there. You may want to draw something, you may want to put you know, something on paper, or you can describe what you're talking about in a different way, because if there's a visual issue there, you might need visual assistance. So you can show them on your phone, for example, something that just will help you encourage that dialogue, okay? Another point too, and this is a good one here, I see, so there's masks available that have a clear plastic insert over the mouth to make lip reading possible. That's a great point, Jean. Thank you so much for sharing. And that's a good one to use because you can actually see a person's complete face when you use those. So definitely using visual aids, using a phone, being considerate, drawing things for a person, definitely bring that notebook with you because that's really important. And then provide opportunities to answer questions. So if you have someone who is, you know, curious about your life, maybe they want to learn more about you, you can actually encourage that too and just share with a little bit about your own experience. when you happen to be meeting with someone who may have a mental illness, often you may not know that a person has a mental illness. You won't need to communicate any differently. So always just assume that they're fine with everything, that you can they can understand you. Yes, and you want to identify if you see the person showing any type of sign of agitation, anxiety, panic, fear, they're disoriented, perhaps. Just make sure you remain calm. If they become aggressive, definitely stay calm, relax. You're in control of your own self and emotions. So just make sure you're regulating your own response, because that's all you can do, really. You can't regulate or control someone else. But if they're going off and you notice something's really awry, you can actually calm yourself down and make sure that you don't add to the height or that tension. And keeping your voice level is very important. So doing that is making a huge difference. And just make and give that person time to talk, to go through whatever is happening with them. Be empathetic, understanding that this is their reality, that's their situation at the moment, but it's not yours. And again, come back to what you're trying to reiterate. If you can come back to a sense of neutrality with them, use short, clear sentences. And if you need to, get support, get some help. If someone can step in and help you and offer you some solutions, great, let's do that. And often tell that person too, before you do it, how you want to proceed, because that person wants to be involved and they want to know what you're doing. And you can use words, be empathetic, saying things like, I understand that you're feeling this. And just going through that kind of understanding in language, they will, understand that you've accepted that hallucinations might occur. They're very real. Delusions can be real for a person, but they're, with a disability, but they're not real for you. So don't pretend like they're real to you. Okay. Just kind of bring them back to a sense of understanding. Okay. Great. And then now, if you're going to think about someone perhaps with an issue with mobility, sometimes people have needs related to their mobility. So for example, they have a wheelchair they use. That chair could be in your way, maybe. You may always ask for permission to move or even touch their chair. Okay, and I can't underscore this enough. I know a lot of people know this, it's common sense, but I needed reminding when I first learned this, in that I thought it was just a piece of, equipment that someone uses. Well, no, that is a chair that people will use. If they use that, it's actually enabling them to get around. And you want to refer to that wheelchair in a very positive manner, because it is something that allows them to be mobile, and it's something that gives that ability to them in their life. So you definitely want to refer to that as, you don't want to say someone who's confined in a wheelchair or wheelchair bound, for example. You want to use positive, reaffirming language, say person who uses a wheelchair, or don't even refer to it at all. Just simply don't, mention it at all if that's the case. And that's because, of course, that chair is it's a symbol of something that enables them to get around, participate in society, and it's liberating. It's not confining. So we want to accept that for them as well, just to understand that. And also just be aware of your own limits and their reach limits. Okay, so for example, if a chair is in the way, you may want to ask them, would you mind if I actually just move this chair over, or would you prefer to sit here? And you want to be at their level. So you don't want to put yourself higher. For example, you're sitting on a bed looking down at them, and they're sitting at the chair, in their chair, looking up at you. So it makes that distance and also disconnect. You want to be at their level, allowing for you to be connected and interconnected. Being aware of also where they are in the room. If they can't reach something, maybe you can ask them, would you like me to reach for that for you? And then if they say yes, perfect, great. And then you encourage that as well. And again, the wheelchair as well, I just want to mention this again, it's really important. It's just to underscore, don't push or touch. It's part of their personal space. So it is very important to them, okay? Next point we just want to mention here is, if a person has a difficulty in speech, don't assume they can't understand what you're saying. Okay, just because they can't maybe phrase it, you may not hear it the same way that they want to transfer that or relay that to you, but you are most likely being understood by them, even though they can't speak maybe necessarily back to you. So don't assume they can't understand, just assume they can. Be very patient, don't interrupt. If you allow them to speak and they're able to speak to you, don't finish their sentences, because it's really important. I used to do that, and I had a really bad issue with this. Even just speaking with anyone, I would finish a person's sentence. As I noticed where they're going in their train of thought, I would say, oh yeah, and this will happen. Okay, great. And I fill in the gap. Don't do that. I don't like it. I notice people probably don't appreciate it. It's better not to do it at all. So when we're speaking, we definitely want to encourage them to talk and don't fill the gap. Be patient and often ask questions. If you need to know something, offer them an opportunity to give them a short overview, and you provide an answer. That's a short answer, and that's great. You can both understand what you're referring to, and it's quick. Also, just being attentive. Don't pretend to understand. So if you don't understand something, refer to it and say, would you mind just re-clarifying what you just said, or repeating what you just said, please? I didn't quite catch that. And they appreciate that. And actually today, we just did a survey today a few times, and I had a person on the phone and they said to me, can you please rephrase that? Because they really were attentive to what I was asking them. I wanted to know exactly what COVID did to them in the last 2 years. How did it affect them? And they did understand one question, and I repeated it twice, so they understood it. So definitely being open to different ways of communicating is important when you're meeting and visiting with people. You want to give the person your full attention. And this is very important because we do want to encourage people to participate fully. And the more they know that you have their best interest, because you're showing them that you're attentive, you're showing them you have energy there for them, and you are excited to meet with them, they will respond and actually want to meet with you more and more as well. So that's really important. Alex often will mention too, I think, right? He has a cousin who is hard of hearing, and oftentimes they will write everything down sometimes when you're communicating, right? So that's a good point to keep in mind, is if that's an issue, you can keep that book, notepad in your reservoir and arsenal. You can keep these tools handy so you can better transmit your own information and also understand that person you're meeting with. Okay, so that's great. And then finally, my personal preference is talking about with someone who has maybe a visual difficulty. And the reason I say this so simply is just because I have personal experience with my own life. My husband happens to have a vision difficulty, and he has often used his phone, and it's something where he magnifies it and makes it quite large. So when you're going into a meeting like that, you're meeting with someone for the first time, you may not know this. So definitely always assume that you want to identify yourself to anyone who's in that room. So you're knocking on the door. Hello, my name is Kathy. I'm here to meet with Susan. Hi, Susan. Nice to see you. I'm just over here, because you might notice they might not know where you are if they're having an issue with difficulty in vision. So you might want to just say where you're located, often using, I'm here to your left. I'm right beside the door. Saying things like that orient you where you are in the space is very helpful. If they happen to be with a guide dog and it's present, and if you're walking with them, you want to walk on the opposite side of the dog, okay? And I do encourage you not to really interact. Don't touch the dog. Just acknowledge it's there, it's present, but you want to be on the opposite side. You're there for the person, not for that animal, obviously, too, and then involving yourself with that. When you're doing something, definitely describe what you're doing and encourage the person to know what you're doing. And so, for example, when you're walking, you might see a beautiful scene of a sunset or some children playing or some flowers or something in the environment. Describe what you're seeing. Describe what you're about to do if you actually help that person maybe move something closer to them, so they're not caught off guard or they're not surprised later noticing that you're moving their stuff. That's a big one too. When you happen to be with someone with a visual difficulty, you don't want to move anything, okay, that they own, especially, without their permission or they haven't asked you to do it, because just moving the pen, even for example, or something, an object, they might be looking for that for the next few days because they don't know where it's located, and you just moved it over one place. So give specific information. If it's non-visual, it's even better. It's helpful because they know exactly what you're referring to. And if someone perhaps is blind and they're eating with you and there's a garnish on the plate, you may want to tell them, oh, by the way, there's a little garnish on the 12 o'clock location, right in front of you. If you want to take that off, or if you don't want it, I could just move it for you. So just being helpful is something you want to just definitely keep in mind. And then often you want to encourage, if they are going to be reading something, or if you want to share something, give them something that's printed, that has bigger sized font on it. So prepare ahead, or at least offer them option to see it, in a better, more clear way. And if it's written information, write it out bigger, make those lines bigger, make it huge so that person can see it and have no issue. Because sometimes I write big, but it's not big enough. So you may actually just want to expand what you're writing even more so than what you think you need to. And then providing large print. Alex will say as well that he has interactions with a person who is legally blind as well. And oftentimes they will print in large font so that person can read everything. And that's important for many, many people, especially with a vision issue or a difficulty. And if you need to leave a person, if they happen to be blind, inform them that you're leaving and ask if they need anything before you leave. That's really considerate. It's really beautiful to know that you're doing that for that person. And then as people age, oftentimes this may happen, their vision may just get a little bit worse as they age. So just keeping that in mind, to always be in a place that's well lit. And so that person can see you and actually make sure that they're understanding what you're doing always, okay? So that's really great. Thank you so much, everyone. I'm gonna segue back to Alex, and Alex will take it from here. Thanks.
Yeah, I was just going to mention that our past president, Amy Hasbrook, for the Euthanasia Prevention Coalition, so similar to Kathy, Amy Hasbrook is legally blind, but she can read. But it's always like she uses her iPad, and everything's super large on the iPad because she can see, but her sight is so poor, everything is just blown up. I'm going to say something right off the bat before we go into the advocacy information, and that is we have developed an advocacy program right here. And so we took this chapter on advocacy, and we recognize the importance of advocacy. We also recognize that there's a lot of people who advocacy isn't their thing. When we go through advocacy with you, you'll understand that that's really something that some people will do very well at, and others not. Advocacy is very important, especially if you consider the way the world is today. There's a lot of people who, especially if someone's quite elderly and has significant health problems, if you've become a friend to somebody and they have significant health problems, it is very important that they not go to the doctor alone. And a lot of people recognize that already. So what will happen is you'll go to the doctor with your mother, etc., or your father, because you know that somebody should be there, not just as an advocate, but also to show the physician, the medical caregivers, that this person is part of a significant community, right? You're showing that this person has importance. And I'm not saying that doctors and nurses are terrible people. What I'm saying is, as a human being, when they see somebody come into the room who's got significant health problems, and they might be quite elderly, it wouldn't be uncommon for a doctor to say, what am I going to do? Like, what are you thinking here? They might be feeling very negative about it, because it's like somebody with a disability. The disability community has the same problem, because remember, a disability is something that you can't cure. It's what they have. They've acquired a disability, or they were born with a disability, or they have a medical condition that's led to a disability. It's not like someone who goes into the doctor and has a major burn or something, or has something that can be healed. It's not like that. And it's the same thing with elderly people. You need to have an advocate with you for several reasons. Now, why? Well, a lot of times someone has trouble stating their feelings about their physical pain and other conditions that they might have. So when you're an advocate for somebody, what you'll do is you'll work with that person, you'll talk to that person, you will help them express themselves, or maybe you will at times try to explain to the physician what that person is experiencing. That person might be afraid to speak out. They might think, well, I don't want to waste the doctor's time. I'm old. They might have these negative feelings about themselves already. There might be a lack of understanding going on. This is another good reason for someone to be an advocate. There's a lack of understanding what needs to happen for that person. The person might also be too ill to speak up. They might be going through significant health problems, and they also might be going through some dementia, early dementia, dementia issues. That doesn't mean they shouldn't receive treatment if they are experiencing dementia. So, what is an advocate? An advocate is a person who stands up for their rights and obtains and maintains their opportunities and helps them gain access to the support services and talks with the healthcare provider. So an advocate is somebody who's helping that person. Now, to be an advocate means you're not representing yourself. You're representing that person. And everything that you're doing for that person is confidential. It's their business. It's not your business. You're just there to help them because you've identified, or that person has identified, that they need to have somebody with them. So it's very important we recognize this, that the role of the advocate is to advocate for another person and to be there for that other person. And everything that they're doing for that person and all the information is completely confidential. It's not your information, it's that person's information. But you can see how this could be very important for someone who has certain health problems and they have a hard time expressing it, or maybe they, the doctor might look at them and say, you're 87 years old. That's the kind of feeling someone might have, right? And I'm not saying they're terrible people. I'm just saying there's a reality in the human person that we react to things in certain ways, especially if someone's got a very busy life. How to be a good advocate. So being an advocate's not for everybody, but a lot of people can do this really well. They have to be a good communicator. That's the first thing. They have to be capable of communicating, or at least be willing to communicate as effective as possible. You have to ask a lot of questions, okay? You have to be able to get answers for the person you're advocating for, because that's why you're doing it. So you have to be willing to ask questions. Now I'm going to say something right off the bat while I'm getting to it. You need to be a good listener, because remember, it's not about you, it's about the person you're advocating for. You need to be courteous and respectful. So let me tell you, you need to be assertive. I get calls all the time. Sadly, I get way too many calls of people who are going through difficult health conditions. Maybe it's a family member, etc., and they're wanting to, just wanting to know what should be happening here, what could happen here. I always say the same thing to people. You must be straightforward, assertive, but you must be so polite and courteous and respectful that maybe it even hurts. Now, why am I saying that? Because you're talking to medical professionals who might get put off a bit by you. And if they get put off a bit by you, they might decide that they don't want to deal with you. But that doesn't help the person you're advocating for. So you need to be assertive. Let's say you're visiting the doctor with your mother, and your mother has certain health issues. And maybe your mother's getting quite old and having some difficulty communicating. Now, as the son or the daughter, you have that relationship and it's clearly identified. But once again, you need to be very polite, very straightforward, very assertive, but very, very kind and respectful of the medical people at all times, because you don't want to create a problem that leads to further problems. And it can happen, and it does happen, sadly. Arrange consent. Well, we have to discuss expectations. So when you're an advocate, you need to discuss expectations with the person. So for instance, if somebody has developed certain back pain or back issues, we need to talk about that. How long has it been? Issues around that. We got to discuss expectations, because possibly there isn't a lot we can do because there isn't a medical answer to their problem, but they do need to have some pain control, or they do need something. Okay, they might need and willingness and being comfortable with advocacy is very important here, because you might have to say to the doctor, well, my friend here has certain health issues right now, and at this moment they can't do any cleaning in their home anymore. How can we assess some home care for my friend here? How can we do this for whoever it might be? Now, to be an advocate, you need to have written permission. So in the booklet, there is a form that was put together that's a sort of a prototype of written permission, and you must complete the patient advocacy agreement. So we recognize that if you're going to advocate for somebody and you're going to be there for them, you must be then there with their permission, and it has to have some legal bearing in order for you to represent them. As I say, it's not for everybody. The advocate talks with the person. Why? You need to find out what they're looking for. If they're going to a doctor, they're going to the pharmacist to pick something up, we need to know what is happening in order to help advocate for them. We need to support them. It's about supporting them. That's what it's all about. We need to act on behalf of them and according to their instructions. This becomes difficult sometimes. It might be difficult to be an advocate if you're visiting with somebody, and let's say they've come to the point in their life where they don't want further medical treatment. You might feel they should have further medical treatment. Maybe there is some benefit to further medical treatment, but they are saying no further medical treatment. Well, remember, there's nothing morally wrong with saying no to medical treatment. It might not be the best idea, it might not be absolutely in that person's best interests, but nonetheless, maybe they can't handle any more treatment. Maybe they've gone beyond that. You're acting on behalf of them and their instructions. Healthcare proxy. Well, it's a little bit different. An advocate and a healthcare proxy is a little bit different. So, healthcare proxy acts if you become unable to communicate. It's based on a healthcare directive, an advanced directive. Euthanasia Prevention Coalition has something called the Life Protecting Power of Attorney for Personal Care. Now, every province in Canada has a little bit different rules around this. Some of them are actually quite similar. Almost all of them are quite similar. I know British Columbia and Quebec are a little different. Most of the provinces are quite similar. Some provinces use different language around this. But being a healthcare proxy and being an advocate are different things, right? Healthcare proxy is representing that person when they're unable to communicate for themselves. And an advocate is someone who's speaking for them, even though they might be able to communicate for themselves. So you're going to go visit. You're going to go visit, let's say, the doctor. So what are you going to do before the visit? Let's say you're going to go to a doctor visit. Well, you need to know exactly what the time of day will be. You need to first gather information. So you need to visit with the person, talk to them. You need to bring a list of medicines. It's possible that this person, as Kathy says, she's got a family member on how many? I don't know, 10 medications? I don't know. Maybe you need to know all 10 medications there are. It's possible something is not going together well. I don't know. I have no idea. What I'm saying is bringing a list of medications is important, something that people are taking. Inform the doctor's office of your role, and that you have a role. And you must be prepared to be there even if there's a delay. So we're getting used to that now also with flying. While going to the doctor's office has often always been delays. Nonetheless, you must be prepared if you're going to be an advocate to be there with the person, even if there's a delay. What do we do? What do we need to accomplish? Well, what are the person's concerns? This is the first issue. What are the person's concerns? So let's say someone's developed some new problems. They have a health issue and their problems have developed a little differently. They're having other symptoms, other issues that they didn't have before. Well, these things should be identified. What are the person's medication side effects, expected outcomes? So let's say someone has been on certain medication for a while. So that's why you bring the list of medications. You might ask the doctor, are these actually, what is necessary at this time for this person? It's possible that things have changed. We don't know. Do they want to discuss new symptoms? So if new symptoms have come up, it's important to discuss it. How do you talk to the doctor about sensitive issues is very, very important because you're talking about sensitive issues. Now remember, you're representing that person. Everything that is said is only for that person. You're helping them out sometimes by taking notes, by talking to them ahead of time, so you're helping them express themselves, but you're doing nothing that is beyond what that person is seeking or needing, okay? That's what you're doing to help support them. Now, actually, when you first talk to them about their concerns and everything, you might actually have some ideas that you might want to share with them, but that doesn't mean they have to accept your ideas, and you're not going to then share them with the doctor if the person didn't want that. That's just how it works. You're an advocate for that person. But your presence may be support enough. Now, why do we say this? Well, it's what I said earlier. A very elderly person going to see the doctor, unless they know the doctor, have known the doctor for years. Like there are some people who've known their doctor for years. That's a different story often. But if let's say you're going to the doctor and they haven't met this doctor before, it could be, let's say, a referral for other issues. And they have other health conditions, especially people with disabilities, because people with disabilities sometimes they have there's certain symptoms around their disabilities, and if the doctor's never met them before, they might be a bit thrown off thinking, oh, what am I going to do here? Well, you're there to support the person, but you're also then also seen as what? Significant community. You are significant community for that person. You know, a prime example, as I say again, if you're going to the doctor with your mother's seen very differently, not only because you're there, but because you're the son or daughter of the mother, and they realize that's family, and that woman is very important to her family, right? Keep a notebook or journal. Now let's be very clear here. The reason for the notebook or journal is not so that you have information on somebody, it's so that they have information. Someone might have memory issues. Someone might have difficulties in different ways. They might have hearing issues, etc. And after the appointment's finished, if you have certain things in a notebook written down, such as the doctor said, we should see you again in 2 months, you seem to have this issue, we should look at this next time, etc., etc., and you've written that down, then obviously speaking, you're capable of then relaying that to this person. But the notebook, the journal, is not your business. It is simply what you're doing to help the person. You record particulars, obviously. The doctor might identify something saying, we have some concerns about this. We think we should do a test on this. You write that down because then obviously speaking, if there's a test that needs to be done, then somebody has to talk to the staff in the doctor's office, clinic, whatever it is, to make sure that's being set up, right? You keep a folder of written responses, and remember, this information is confidential. Now, there might be some issues for someone who's, let's say, an active nurse. If you're an active nurse and you're being an advocate for somebody or a doctor or a medical person, the notebook becomes a bit of an issue at times because that's seen as an illegal document, right? You have legal obligations when you become a nurse, a doctor, nurse assistant, these kind of things. In this case, I'm not a nurse nor a doctor, nor do I claim to be. And in the case of being an advocate, you're only representing that person and that's it. And you should always act like you have no idea about any of this stuff. It's only that person's information. During the visit, you take notes, you respect a person's privacy, and you ask questions. Now remember, don't be intimidated by a doctor or nurse who might, some people have a bit of an uppity attitude. I'm not saying they all do. Some are very human and down to earth, but not all of them are. Some of them are a little bit uppity. Don't be intimidated, but always be respectful. Always be straightforward, but very kind and respectful. And as I'll say again, be so respectful, sometimes it might even hurt. You're so respectful that no one could accuse you of being overly pushy or rude. You should never be accused of that when you're being an advocate for someone, because you're not going to do that. You suggest that they provide answers. So the doctor might be saying, there's some issues here. You ask, well, are there some, what are the options here? What are the options here? Inquire about services. As I said, maybe, as I say, someone is having very difficulty getting around now. They have a hard time, with their mobility. They shouldn't be living in a dirty home because they can't clean their home anymore. And when there's some services that might be available to them, remember, when the doctor is saying that they agree that this person should have some services, I'm not saying that's going to make it possible to obtain the services, but it makes it possible now to seek those services, right? Ask for information sheets. Well, Dr. Google's got information sheets, but your doctor and nurse, they also have information sheets, and these information sheets are important. They allow us to know what's going on, and they give us information. Make follow-up appointments. So if the doctor says, we need to see you again in 2 months, then you help that person by saying to that medical clinic, then the people running the clinic, we have an appointment that we need in 2 months. And you set the date for that appointment, help them set the date. You fill any prescriptions with them. Maybe you have to go in, maybe they have real mobility issues, and as the advocate, you're going to go in and fill the prescriptions. Discuss the appointment with the person. I'm going to say something about prescriptions. Pharmacists today have the legal right, at least I know in Ontario they do, to examine one's prescriptions. Because sometimes pharmacists have more information about individual prescriptions than sometimes the medical people do. It's possible at times. And sometimes the pharmacist will identify, well, maybe you shouldn't be receiving this and that together. That's not a good idea. So it's a good idea when you're advocating for someone to not only have the doctor look at what medications have been prescribed, but to also ask the pharmacist to look at it And remember, the pharmacist might say everything's fine and dandy and good. Well, at least then you know that it was confirmed. You're not being rude, you're not being anything, you're just helping them find out. As an advocate, you are invaluable in helping to make our world a better place for those in need. Now, remember, there's a lot of people who need medical treatment and care and are having difficulty. Let me tell you, yesterday I got a phone call from a lawyer I've been dealing with for many years. He's a disability lawyer. He's taken a lot of disability cases. He's worked with Euthanasia Prevention Coalition for many years. And he was talking to a woman in Toronto who's been approved for euthanasia. She's been approved for euthanasia. She has cerebral palsy. She's only 35 years old. And the reason she's asking for euthanasia is her back has degenerated to the point where she needs surgery to give her stability in her back because it's too painful otherwise. She's in too much pain. So, a lot of people with cerebral palsy at a certain point need to have that surgery done to stabilize their back. And they're saying, oh, well, we can't schedule that. There's no time in our scheduling for that surgery. She can't find a surgeon. She's been working on this for a long time to find a surgeon. She's in real bad pain. This is not a nice situation for her. And there is an answer to her problem. And it's a normal answer to her problem. And so she went and asked to be assessed for MAID, and she's been approved for MAID. And then she contacted this lawyer friend of mine, and he's instead said, no, you're not having MAID. What we're going to do is we're going to make a big legal case out of this, and you're going to get your surgery. You're going to get your stability in your back, because obviously he said there's no other way. You can't go around without having a stable back. I'll tell you another story. You might have seen the story out of CTV in BC, the woman who's been fighting for medical treatment for years, and she was also approved for MAID. And this is a whole other case. She's got another type of medical condition. But once again, she's got a medical condition where she's not going to get better. She knows she's not going to get better, but her symptoms are treatable, and she's having an impossible time getting treatment for her symptoms. She had no problem getting approved for MAID. That didn't take very long. But getting treatment for her symptoms, she's been fighting for years for this. She says she's been fighting for over 5 years, and she's struck out. So she's got on social media, she's trying to raise money so she can go get treatment in the US, because she knows she can get treatment in the US, but she can't seem to get treatment in Canada. Now you're thinking, how could this be? Well, I just say I wish it weren't, okay? But this is the kind of thing that's going on, and sometimes an advocate ends up becoming a lawyer. Advocate's code of conduct. I will practice with compassion and respect for the person with whom I work. My primary commitments are to promote the health, safety, and rights of the person. I will be transparent in my work with the person. I will maintain privacy on behalf of the person and keep confidential all activities and records unless speaking with my supervisor for advice. Now that's if you have a supervisor, that's a different situation, right? I will guide and assist the person in medical decision-making, but at no time will I make decisions about health or medical care or medical services on their behalf. I will respect the person's values and belief system as the foundation for their decision-making. And here we go. So the next topic we're going to talk about is not a pleasant topic. It's a topic I don't like to talk about, but it's a reality. I will go through some of the information with you. There's quite a bit in the booklet. You'll notice that this chapter in the booklet on elder abuse goes through a lot of information, and then there's more information that you can read about it, and there's actually some information about links in that. And the email version, it's actually a bit better than the book, because the printed book gives you links to articles and everything, but then you'd have to type in the link. But the email version that Kathy might have sent you, you can actually, it's a live link. So that's actually a little bit better for your purposes if you want to read more about it. But the sad reality is you might be visiting somebody. Let's say it's someone, as an example, from the Catholic Women's League. Okay, I'm just using that as the example. I know I had a question last time, just all about Catholic Women's League. No, but let's say you're a member of the Catholic Women's League and you're visiting someone who's a member of the Catholic Women's League who's much older, and therefore you have that type of a connection. And when you're visiting, there seems to be signs of a problem. I'm not suggesting that's ever going to happen, but I'm suggesting it might happen. And sadly, it's becoming too common. And therefore, at a certain point, you can't You can't be silent about it. And this is the problem when you get involved with visiting people. There, you might actually bump into this, and so we have to talk about it because we realize we can't turn a blind eye to something that's happening to somebody. And as I say, it's more common than we want to actually think. Signs of abuse. Well, sores or injuries. Now we're talking about sores, like if you see someone, they have some sort of sore or an injury, and it's the first time you ever saw them, you might think, oh, that's too bad. Poor dearie, she's got a sore. This happened. She might have fallen down or whatever, and she might have an excuse for it. But you know, if you go visit them 3 times and 3 times they've got 3 different injuries, you've got some concern going on now. And this is not an easy situation. A vague or implausible reason for the injury. Now remember, most elder abuse happens by family members or friends, and often people don't want to talk about it, so they're going to give an excuse. Oh, well, you know, I fell down, this happened, that happened. Not seeking care for an injury. Well, if they're not seeking care for injury, then they're covering up for the injury often. Now, they might be very elderly and have a bit of dementia going on, so you might say, oh, maybe not, maybe. But you know, usually when someone has a serious injury, they do seek care for it, especially if they're older. And if they're not doing that, there's a good sign that there's a problem going on. Messy and unclean appearance. So they start having very low self-esteem. They feel different about themselves. You might have remembered that they used to see them going down the street, you know, 10 years earlier when they had mobility. They go down the street and they always looked nice and clean. They always had, you know, reasonably nice clothing on. They took care of themselves. And now you see them and they're really messy, unclean in appearance. So either it's because they're not receiving they're not receiving care that they deserve, or it's because they've gone to having very low self-esteem or other issues. Malnutrition and weight loss. Now, I've lost weight, but that's because I do a lot of running. So that's not me. I'm not being abused. Okay, nothing personal. I shouldn't joke about it. Sorry, but I have done a lot of running. That's why I've lost weight. But if you see someone who's going through malnutrition and weight loss, they might have a serious illness that's leading to them experiencing significant weight loss or malnutrition, or they might be experiencing elder abuse. Dehydration is a big effect. Now, remember yesterday, Kathy went on quite a bit about the issue of dehydration, and that's because as someone ages, their body absorbs fluid to a different way than when you're younger, right? So therefore, it's easier to become dehydrated when you're older. And this is just a reality. But if they're dehydrated, that means often that they're not receiving fluids, they're not being properly cared for. So it could be a sign of neglect. If they're afraid of you, they're afraid of somebody. You go up and you go to put obviously you don't want to just touch somebody because you need permission to touch somebody. But let's say you knew them for years, and this is someone that you've known for many years, and you haven't seen them in a while, and you just sort of greet them, and they sort of go back on you. Well, obviously they're reacting to you because that's happened to them before. What about someone who used to be quite well-to-do and now seems to be in total poverty? Well, financial fraud has become such a massive problem. You know, there's been a lot of news stories about it too. But if you start talking to people, you realize that a lot of people have experienced financial fraud. And you might say, oh, how could they have been so stupid? Well, guess what? These people who are doing financial fraud are professionals. They rope you in. They get you. You may not expect it at all. You might be just thinking, this is someone who seems to be really nice. We're talking, I'm helping them out. Let's say they claim to be this, they claim to be that, and they really have their act together and how they're explaining themselves. My heart goes out to them. No. It's not that someone's stupid. It's that somebody was a professional, took advantage of them. Exploitation is very common. Then there's the issue of sexual abuse. Sadly, sexual abuse occurs. How that might come up is they might feel comfortable with you and they might tell you about things. Physical abuse is an act of violence that may result in pain, injury, impairment, or disease. And neglect is the failure to provide the goods or services necessary for functioning or to avoid harm. Now, neglect is very sad here. There's a lot of people who might, how would you say, live in a nursing home where, because of their how would you say, the disabilities they've developed, etc., they might not be receiving enough food and fluids. They might not be receiving the care that they need, not maybe because the staff was intending it, but because you have your own difficulties and everybody else can go to the dining room for lunch and you can't. There's many issues that might lead to this, or it could be just that somebody really is neglecting you. If you notice the issues of neglect, these things have to be dealt with. Doctors or the healthcare providers are not notified about elder abuse. That's what happens. When we're talking about elder abuse, it's not reported. You hear about elder abuse after the fact. You hear about, isn't it sad that so-and-so had this happen to them? Usually people don't talk about it because it's usually happening within a family or it's happening amongst friends. Someone knows the person and they're thinking often that it was their own fault. What about when you're visiting someone and they have a wound and it's not healing and it's sort of smelly, you have this problem. Well, why have they not called a doctor? Why are they not trying to help themselves? Often that's related to elder abuse. The person has not received medical care. That's a big sign. And as I said in the earlier signs of elder abuse, the big sign is they've not received medical care, yet they clearly have something that you would say should be receiving medical care. Most common injuries: bruises, pressure sores, and fractures. Now, bruises are often caused by a physical, superficial, like abrasions are superficial injuries. They involve the outer skin. This is caused by the movement of the skin over a rough surface. It's evident both physical abuse and neglect. So, somebody is physically grabbing somebody, somebody's hurting somebody in that way. And so this is showing up often in, that they've had cuts or they've had bruises that are significant and noticeable. The bruises happen when a blood vessel ruptures. So this, often the type of the bruise and where it is will also suggest the cause of the injury. The common location of a non-accidental injury would be on a face or a neck. Okay, these are sad things to talk about. The result from the tissue exposed to heat over 50 degrees would cause a burn. So burns are categorized by how much surface area is affected and how deep the damage is. Now, it's a totally different thing, but when I was younger, I was involved with scouting, and I went camping on the weekends and had a lot of fun. But the one weekend, I had serious burns to my hands. What happened is I actually had fallen down, and my hands went into the fire, and I had serious burns on my hands, right? So they were second-degree burns, not third-degree, fortunately. But obviously, when the doctors were assessing that, they were assessing that based upon the amount of burn I had and the type of burn I had, right? And it's the same thing. But what you need to know is persons over the age of 65 have double the national death rates after a burn. So if you're over the age of 65, you're twice as likely to die from having a serious burn. If you're over 75, you're 3 times as likely to die from having a serious burn. And if you're over 85, you're 4 times as likely to die from having a serious burn. Okay. Fractures. Well, we don't have to talk about it too much, but nonetheless, older people are more susceptible to fractures. It might be as a result from bone disease or injuries that they might be more susceptible to it. But if they are experiencing a physical abuse, they might experience more commonly than a fracture. Now, in the case of someone who's had disease, like for instance, if you've had cancer, your bones become very brittle from the cancer. The cancer, one of the things that cancer does is it really robs the bones of their density and their strength. And so you might have gotten better from cancer, but then you would still have, issues with weaker bones afterwards. Common sites are a hip and a wrist. Elderly people are at risk of spontaneous fracture, though. So, fractures, these are difficult things. Now, once again, abuse could lead to a fracture. Lacerations are the result of a blunt force. So someone actually hit them. Someone's used something to hit them or hit them, characterized by a full thickness or splitting of the skin, common in physical abuse, but can occur with neglect. So these are the kind of things. As I said, we're talking about this because you should know that these are possibilities, and sadly, we need to talk about it. Pressure sores. Now, what is the best care for a pressure sore is prevention. When you hear of an older person who is in a hospital or a nursing home and they have some significant health issues that makes them less mobile, and they had developed a pressure sore, this is a serious problem because a pressure sore can lead to death. A pressure sore can get infected. The way to deal with a pressure sore is to prevent the pressure sore. So let me give you an example. The current president of our group, You know, he is a person who's been disabled since about the age, I think it's 20 or so. He had an accident when he was younger, and so he's a disabled man. And so because he's in a wheelchair all the time, you notice when he's talking, he's always going like this. He's pushing himself up. He's moving around. He talks about that if he stays in a position for too long, he's got to move. We talked about the fact that he's going to be speaking at a conference for us. And he said, well, when I get off the plane, that means I'll have been sitting in a place for too long. I'm going to have to rest a bit in another position for a while before I get back into my chair, because I don't want to get what? I don't want to have a pressure sore. So what's he doing? He's preventing pressure sores. So when they talk about someone who, let's say, is lacking mobility, it's important to have these people turn, right? When you're caring for people who lack mobility, you have to turn them regularly from one side to the other side. Why? Because you don't want them to develop pressure sores. I think pressure sores are related to neglect. Now, it might be easy for me to say that, you would say, because, you know, there's not enough nurses in our system anymore, et cetera, like that. And I'm not going to argue with you that that I agree there should be more nurses in our hospitals, et cetera, because certain things have to be done. Nonetheless, the person who's experiencing a pressure sore, I clearly see that as neglect. Restraints. Well, restraints used to be more common than they are today, but they're still being used. There are some countries actually that have outlawed restraints. Restraints might seem to be necessary in certain circumstances. So let's say somebody has dementia and they're getting aggressive. As the institution that the person's in, they might think that a restraint is necessary in certain circumstances. The problem with the restraints is that you know, it leads to neglect and abuse, but on top of it, it leads to injuries. And most often restraints lead to a worsening of behaviors. So if you read all the medical journals about restraints, that yes, we recognize that there's certain times where it seems better to use a restraint, and they would say, I'm trying to protect this person, so we're using a restraint. But when you actually look at the issue itself, restraint should not be, it should be really a last resort at best. But the fact of it is restraints can be very much of a problem. And I'm just saying that to you because you might visit someone who's in a nursing home and you notice that they've been restrained. And unless that's because they had no other choice whatsoever, I would be concerned about them. I would be very concerned about them. Skin tears. Well, in sites other than the arms or legs or multiple tears and abrasions, they should raise suspicion. Skin tears here healed with scarring. So if you're, once again, the problem is when you're visiting somebody, you visit them for the first time. You might have known them years ago, but this is the first time you're seeing them in years. You feel sorry for them. Oh, they have some injury. They have this happen. They have that. But then you go see them 2 weeks later and they have a similar problem again. You know, this is what's happening, and you can't be silent about it. Malnutrition, often a mark of neglect. Part of the issue is also recognizing cultural fruit preferences. I know Kathy talks about the fact that her husband comes from a Polish family. I mean, from a Portuguese family. She comes from a Polish family. There's different sort of food preferences. But even if you're talking about, you know, a lot of people, you might have someone who comes from, you know, they come from a Chinese or a Japanese background. And so they're not interested in certain foods, especially when they get older, they might be seeking certain foods. Nonetheless, malnutrition is often related to improper feeding techniques. When someone's having difficulty feeding, the difficulty is let me tell you a very sad story. Actually, I don't know if I should tell you this story, but it was a very sad story. I got a call from someone, and this was during COVID, and they were very upset because their mother, who was in a nursing home, had dementia, and this woman went every day to feed her mother. She said, there's not enough staff to feed my mother, and my mother has dementia, and it takes a little bit of time to actually feed her. It takes time. So I go every day and feed my mother. And then COVID broke out and she was denied entrance to the nursing home, and her mother died a few weeks later. And she called all, like, she was very sad. She was wondering what she could do about it. We had significant conversations about it. But, you know, there's lots of things that happened during COVID, but this is the kind of sad stories that happened also. Anyway, people sometimes need to be properly fed, and sometimes that takes a while. I'm not saying you're going to do that. In the case of your own mother or your own family, you might very well be doing that, Dehydration, signs and symptoms, confusion and sleepiness. The interesting thing is that when someone's experiencing dehydration, sometimes it appears that they're experiencing a bit of, that they're starting to lose their ability to think, right? And someone's saying, oh, isn't it sad that dementia's coming on? Your mother seems to be losing her ability to really think things out and everything. She's getting confused all the time. She wants to sleep all the time. If you recognize that, I think the first thing to try is keeping her properly hydrated. Hydration really does change that, so if they actually are experiencing dementia, then, obviously they will continue to experience these problems. But if they receive hydration, then they will come out of that and they will return to the way they were before. And you may say this doesn't sound very common. Sadly, it's actually very common. Risk factors also, how the medications react when the body's dehydrated is very different than how medications react when you are fully hydrated, right? So you have this decreased absorption. So there's different than effects of the medication on a person when they are dehydrated. People with dementia may not recognize that they are being abused. This is the sad reality. They may not be able to report the abuse, and they may not be believed. So, when you're talking with someone with dementia, so let's say you know somebody and they have a certain level of dementia and you're visiting them regularly. You might end up becoming that person's voice because they might not be able to speak for themselves. And the issues of neglect become very important when someone can't speak for themselves. Self-neglect. Well, self-neglect not only accompanies dementia and mental health issues, but also when someone's experiencing types of abuse, they often feel very different about themselves. They feel, so then, they change their attitude towards themselves. So sometimes self-neglect is not only dementia and mental health, it's also a sign that they are experiencing abuse. But it makes the victim more vulnerable. They become, in the case of neglect, often these people are very dependent on the other and they're being neglected. Abuse or neglect leads to depression, which often leads to self-neglect. Alcohol abuse. 5% of older persons have problems with alcohol. Now that might be changing all the time. It's more common in men than women. Lower levels, as you get older, it takes lower levels of alcohol to feel the effects of the alcohol. So it's just an important factor. Financial abuse. It's considered the crime of the 21st century. If you consider that widows and widowers, a lot of these people, due to the reality of real estate, the fact that they've lived their life and they paid off their homes, they might have some money in the bank, they might have sold their house and then moved to an apartment or moved into a nursing home, and because they sold their house at some astronomical price compared to what they ever paid for it, they might have some serious money, and financial abuse has become a huge, massive issue. I've personally experienced financial abuse. I was a friend of mine who I was being an advocate for, who experienced a lot of financial abuse, and I had to take over his finances completely just to prevent it. I have a family member also that experienced significant financial abuse, not to any fault of that person, but because that person was actually hoodwinked enough and they just didn't realize what was going on until it was too late. And you may say, once again, how could that be? Thousands of dollars, how could that be? Well, maybe they were too trusting. Maybe the person who was taking advantage of them just knew their thing. But the other thing about the crime of the 21st century, a lot of financial abuse happens in families. The son or the daughter who never really made much money themselves were always sort of dependent on dad and mom. And now they're older and they are constantly taking money from them. So when you're visiting someone who had a fair amount of resources and suddenly you're visiting them, they seem to have nothing, maybe it's because they have nothing. Maybe it's because it's been taken from them. How do you protect them? Well, in the one case, the person I ended up taking over their finances for, I contacted the police about it. I was just helping this person out at first, and then I contacted the police about it, and they said, oh, yeah, we already have a file on that one. Yeah. And I thought, what do you mean you already have a file on it? Oh, yeah, there's already been complaints about this. Yes, yeah, we have files on that. We've had complaints before. And that's, of course, when I decided, oh, I guess I got to take over the finances because then no one has access to them other than me. And I'll make sure that this person has what little that's left, they have what they need. As sad as that seems, it was necessary. And I didn't have time for that. Nothing personal. I just didn't have time for it, but it had to be done. Compassionate community care. So everything we've done for you today and in our training and support programs and everything we're trying to do, we've obviously offered it to you at no cost. The training manuals, the whole bit. We seek donations to exist, and we haven't had a problem with that, and that's why we continue to go. People recognize that what we're doing has got a lot of worth and meaning to it. The other thing is that we'll continue to provide these training programs. So let's say you're part of an organization and you've taken this training program tonight and last night, and you're saying, well, we should have 3 or 4 people of our group take that. Well, when we offer it, let's say next month or the month after, we can have them sign up. You'll get the emails and everything, have them sign up, and they can also take the program, and it'll provide lots of information. Now, the booklets actually provide a lot more information than we did. We've gone just over it. There's a lot more information here in the booklet and forms in the booklet, etc. That and as I say, if you go to the online link, it's actually has live links in it, which is even better. But that's something that you can read through again. The My Story handbooks are being sent to you if you ask for it, or it's been emailed to you. You can print it up. Once again, the My Story handbook could be just used as a guide. And I've suggested with the My Story that the best thing to do is have a notebook and take notes. The difficulty is some people might have to use a laptop or an iPad when they're talking to someone. So there's information here you can contact. You can email Kathy at any time.